Hey, okay. So today our topic is about some skin cancer awareness. Summer is here and we would all love to enjoy ourselves, but of course we should always bear in mind skincare protection and not to harm our skin in the process. We will be addressing several topics today. First, we will start by talking a bit about sunlight, why it's harmful to our skin, what is the role of ultraviolet radiation, including also what are the types of UV radiation. Then we will move on to talk about the different skin cancer types. I think most people are pretty familiar with melanoma because that is the skin cancer type that is most frequently spoken of, but actually we have several other skin cancer types that is very important to know about and that we as dermatologists see quite frequently. Next, which is I think the main priority of everyone here, is the protective measures. How do we protect ourselves from the sun's harmful rays? Some new fashionable habits that many people have been adopting in terms of tanning and indoor tanning. We'll be talking a bit about this. Is indoor tanning more harmful than being out of the sun, or is it okay? And last, about vitamin D. So we know that we need sun exposure for vitamin D intake, but should we really be out in the sun to have sufficient vitamin D, or should we not? So we'll be addressing these different topics during the session. So sunlight is the main source of ultraviolet radiation. And whenever we talk about ultraviolet radiation, we have three main types. For our purposes, in terms of the skin and skin cancer, we are interested in what we call the UVA and UVB. And previously, long ago, most of the studies on skin cancer, they were focused on the harmful effects of UVB radiation. But actually, more and more, we know that UVA also plays an important role in this. And actually, about 95% of the UV rays that come from the sun and reach the ground are actually UVA, while only the remaining 5% are UVB. Why am I bringing this up? Because later on, when we go on to talk about sunscreens, it's important that when you go to choose a sunscreen, that it says broad spectrum. So it covers both the UVA and the UVB spectrum. Previously, long ago, it was more focused on covering the UVB spectrum, but today we know it should be broad spectrum that also covers UVA. Also, another important point here concerning the ultraviolet radiation is that UVA specifically can penetrate through glass. So just because we are indoors or driving out in our car doesn't mean that we're protected from the UV radiation, because specifically the UVA can penetrate through glass and thus exert its harmful effects on the skin and bring about skin cancer. When we're living in different areas of the world, of course, we are exposed in a different way to ultraviolet radiation. So the amount of UV rays that we get is very much dependent on several factors. First, the time of day. We know that UV rays are the strongest between 10 a.m. and 4 p.m. So during this time, it's important to be very well protected or even stay indoors. The season. UV rays are generally stronger during spring and summer months. The distance from the equator, so countries that are farther away from the equator get less UV exposure. The altitude, and something here is important to mention, is clouds. So just because we're outside on a cloudy day, it doesn't mean that we're not getting the UV rays. UV rays penetrate very easily through clouds, and especially if we're up in the mountains, let's say, and it can feel cloudy and cold, but actually on high altitudes, the UV rays are stronger. So it's also important to protect ourselves even if the clouds are there. UV can even reflect off surfaces. It bounces off surfaces like water, grass. So even if we're swimming in the pool, the ultraviolet can still bounce off the pool water and harm our skin. Skin cancer is the most common cancer, contrary to what many people might think. And more people are diagnosed with skin cancer each year in the US than actually all the other cancers combined. So it is actually quite very much prevalent. Most of us know about melanoma, but there are many different types of skin cancers. And 95% of these skin cancers are related to sun exposure. The main cancers that we will be talking about today, and those are the most common ones, they are the basal cell carcinoma, the squamous cell carcinoma, and the melanoma. Now, these three different skin cancers, they behave differently. So melanoma, which is the most one that is known, it's actually the most aggressive. The basal and the squamous cell is less aggressive. So it's important to know just a bit of background about the different skin cancers, because basically during the consultation, your dermatologist would probably ask you if you have a family history of it. So it's worth noting which type of skin cancer you have in your family history. Having a family history of melanoma, let's say, is much more serious than having a family history of a basal cell carcinoma, because these different cancers act differently. We'll be talking more detail about them. So although melanoma is the one that is most known, it's actually much less common than the other two cancers, which is the squamous cell carcinoma and the basal cell carcinoma. But the vast majority of deaths is from melanoma. So this is why it is actually the one that is most famous. Sorry, can we just ask everyone to just mute their mics, please? Okay, so we'll go forward. Another point I want to mention is that skin cancer can affect people of all skin tones. I've noticed there's a lot of awareness among the lighter skin types, the Caucasians. Many of the patients, they want to get their skin checked because they have lighter colored hair, lighter eyes, etc. But also it's important to know that skin cancer can affect people of any skin tone, even those with a darker complexion. And actually, when melanoma occurs in people with darker skin, it's more likely to happen in places that are hidden or not classically exposed to sun. So like around the fingernails or on the backs of the feet or the hands. So all types of skin tones can get melanoma. And so everyone should really protect themselves. So by limiting or avoiding the UV radiation, you can really reduce your risk of skin cancer. And by constantly monitoring your skin and visiting your dermatologist at the regular intervals, which we'll be talking about, then you can check your skin for suspicious changes. And this is the key basically to treat these things, because with early detection, skin cancer, you can have the greatest chance of a successful skin cancer treatment. And more often than not, it's a matter of just removing the lesion, and that's that. Whereas if we catch it in a very late stage, it becomes more complicated. So the most common type of skin cancer, as I mentioned, is what we call the basal cell, or the BCC. This cancer, it appears as a slightly transparent bump on the skin. We call it in dermatology terms like a pearly lesion. Most often it will show up on sun-exposed skin, like the nose, like on the ears, the lips, even the chest or back, but it can show up in many different forms. So it can come as basically just a patch that's not going away, or an ulcer that's not healing. So anytime you have a lesion which is just not resolving on its own, or something that you did not have before, it's always worth getting it checked, because many of these lesions can present in atypical manners. And here is just a few examples of the basal cell carcinoma. So you see the pearly, transparent to red bump. Basal cell carcinomas generally have a very good outlook. Most of the time, if they're caught in a good amount in early on, they just need to be removed from the skin. Mostly we treat them by surgically removing them. However, if they're in a very early stage, or they're found on the chest or the back, then your dermatologist would just maybe freeze them, or even give a cream that boosts the immune system against the cancer. Now, once you've had a diagnosis of a skin cancer, even if it is something, even if it was one of the, let's say, good skin cancers like the BCC, you're at an increased chance of developing another. So you need to be more careful with the sun protection, and even maybe come to your dermatologist more often to get your skin examinations, because these lesions, they do tend to come back, and especially right after you remove the lesion. So the basal cells that can present on the nose, ears, or lips, they're more likely to recur after removing it, usually within the first 2 years. And that's why once we're diagnosed with one of the skin cancers, very often we tell the patients to come for more frequent skin checks, like every 6 months instead of every year, just because it higher the risk of them getting another skin cancer. The next skin cancer I'll be talking about is what we call the SCC, or the squamous cell. And this is the second most common form. It presents like a bump or a scaly growth that bleeds. It looks a bit angrier than the BCC that we spoke of. And again, just like the BCC, it happens mostly on sun-exposed skin. So this just proves more and more that it's mainly the sun exposure that is causing these skin cancers. This is just an example of what it looks like. A very frequent condition that we see in clinic, and I would also like to raise some awareness about it, is these small red patches. We very frequently see them on the face or even on the head of men that have some hair loss, just these red patches with some roughness on them. This is actually a precancerous lesion that we call actinic keratosis. So these aren't a problem in and of themselves, but we like to treat them because leave them 10, 20 years, 30 years, they may turn into the squamous cell carcinoma that we spoke about. So these usually in clinic, we just freeze them with the liquid nitrogen. It's a pretty simple procedure, but it's good to have them addressed so that they don't turn into cancer later on, years down the line. Now we come to the most well-known form of skin cancer, which is the melanoma. This is the most serious type, and this is basically why many patients present for regular mole checks to make sure that they don't have melanoma. Melanoma will develop in cells that produce the melanin, which is basically the brown pigment in the skin, which gives us the brown color. It is the most aggressive type, but when detected early, we have a very good prognosis. And most of the time, we just remove it surgically and it's done with. Whereas if it's progressed, then we go through many more advanced steps, including imaging and so on. So the key is really to catch these things very early on. So melanomas, they may develop anywhere actually, but more commonly in sun-exposed areas. And as I said, with the darker skin types, they're more frequently found in areas that are hidden. Like in this picture here, you can see it's on the back of the foot, somewhere where it's a location where someone might not think to check. That's why whenever we have patients coming in for skin examinations, we really do a thorough examination, even in between the fingers, behind the feet, anywhere. So what are the risk factors for melanoma? The first and primary one is basically exposure to the sun, which is the topic, which is our topic today. Indoor tanning by studies has been shown to greatly increase the risk of developing melanoma, and we'll be talking more detail about indoor tanning. People that have many moles on their body or irregularly looking moles have a higher risk of developing melanoma, and these patients should be presenting more frequently for skin check examinations. People with fairer complexion, blonde or red hair, blue eyes, freckles. So these skin types, again, it's a risk factor for melanoma, so they should be having their annual skin check examination. And lastly, family history. So anytime we have a close relative who has been diagnosed with melanoma, this increases the individual's risk of developing melanoma to double or even 3 times higher. Now, melanomas actually, although we always come for mole checkups, melanoma can develop in normal appearing skin. So you can either have melanoma, let's say, in a mole that you've had for a long time, and then suddenly it started changing. So this concerns us for melanoma. But in many times, actually in 70% of the time, it's just a new spot that popped up, and it's basically a melanoma. So how do we know which signs are worrisome? How do we know when should we go to the dermatologist? We have our moles, right? And moles change from time to time, and this is normal. But how do we know that this specific change warrants a visit to our dermatologist? There's something, to put it quite simply, called the Abcde Rule. And this is something I like to explain to all my patients that come for these skin checks. So A, B, C, D, E for asymmetry, border, color, diameter, and evolution. We'll go through them one by one. So A for asymmetry, basically if you draw a line in the middle of the mole, as in the picture here, one side looks very different to the other. So it's asymmetrical. These are the bad signs, which would warrant you to have an appointment with your dermatologist. B is for border. So if your mole is not a perfect circle, it has an irregular border or protrusions coming out of it. C is for color. So if you have more than one shade of brown, it's normal for us to have different moles with different colors of brown, but if you have different shades within the same mole, this is one of the bad signs, like some places that are light, some places that are dark. D for diameter. So if it is a big mole, that's more than 0.6 centimeters. And E for evolving. So any quick change that is happening, rapid growth, rapid change in color, bleeding, itching, all these can be worrisome signs. Now, it's not like when we have one worrisome sign, that's it, it's a melanoma, no, but these signs are what we look for, and this would warrant a visit to the dermatologist, and then the dermatologist would decide if it needs to be removed or not. Another important and simple sign is something that we call the ugly duckling sign, basically a mole that stands out relative to the rest of your moles. So let's say you have 30 moles on your back. They all look pretty much similar, but there is this one single mole, like you can see in the picture here, that just stands out. This is also a sign to get that specific one checked. And here are examples of melanoma. So applying the Abcde rule, you can see like in the first picture, it's not symmetrical. It has two completely different colors. The border is not regular. It has these irregularities coming out of it. Another lesion that I would just like to bring up, because many times I have patients coming in with this and they're worried because it suddenly popped up and they're scared, is it melanoma? Is it a skin cancer? This is something that we call the Cyboria Keratosis, which is basically just a benign skin growth, and it can look like a mole or melanoma. It just appears suddenly, but usually those, they just come with age. They're these stuck on rough surfaced spots, which are actually not moles in origin, but they can look very similar to moles. So these usually we just freeze them off or just leave them be. So this raises the question about how often should we get our skin checked, and should everyone get a skin examination? According to the recommendations, we should get a full body professional skin exam once a year. And those with strong risk factors, like very lighter skinned people who have a strong family history of melanoma, they have a lot of sun exposure, it would be advised even to get your skin checked every 6 months. Now, of course, if you notice something peculiar, you should not wait for your annual skin exam, but as a routine, it should be checked between 6 months to 1 year, depending on your risk factors. And then sometimes if we see something suspicious, we can either remove it, but other times we may say just that we need to recheck it in 3 months. So we don't automatically remove everything that we see as slightly irregular. Many patients ask about mole mapping. So what exactly is mole mapping? Basically, it's a non-invasive procedure where your moles are mapped through a machine. So instead of me as an individual doctor looking at your moles and using my clinical judgment and then comparing your moles after 1 year, let's say, this is a more objective way of doing it. So the machine analyzes the moles, of course, together with the doctor, and takes pictures of them. And then with all the measurements of the moles. And then you come back 1 year later, you can compare to your previous pictures. So it's just a more standardized way using photography to document your moles. How about melanoma in childhood? Many parents come with their children to check out certain moles, and they get worried because they tell me, well, this wasn't there since birth, it just came out. Actually, most moles, they appear during childhood and young adulthood. So most of the moles were not really born with them. They appear later. And it's normal that as your child grows, the moles are going to grow with your child, and they're even going to change color. The natural way that moles evolve is that they start as a dark brown color, and then with time, they can lose their color and even become bumpy. So they start flat and brown, and then they can become bumpy and lose color. This is a normal evolution. And just as a reassurance, the actual melanoma rate in young children is very, very rare. However, it is never early to develop good habits and teach your child how important it is to know your moles. So even with children, it is good to have an annual skin check examination and get them into the habit of using good sun protective measures. One instance where you should show your child to a dermatologist is if they have a giant mole. So a giant mole is basically a mole that usually we say bigger than 20 centimeters. So it would encompass a whole region of the child's body. And usually it's a mole that the baby is born with. These moles do have a risk of melanoma. So any child with a giant mole should be closely examined because these have a higher risk of developing melanoma before the age of 10 years. Now we come to safe sun measures. How do we protect our skin from all this? There are several ways. It's not just by applying sunscreen. First, we should always seek shade when appropriate, especially during the day when the sun's rays are strongest, between 10 a.m. and 2 p.m. Always try to sit in the shade. Protective clothing, hats, sunglasses, very important. Wearing long sleeved shirt if we're out in the sun, together with the sunscreen. When it comes to sunscreen, we need to choose a broad spectrum, water-resistant sunscreen with an SPF of 30 or higher and apply it to all the areas of our body that are not covered by clothing. And I'm going to be talking more about sunscreens. So how do we know what sunscreen to buy? I mean, you go to the pharmacy or the supermarket, there are so many different sunscreens. How do you know which sunscreen to choose? Well, there are several things that the American Academy has recommended which should be in a sunscreen. First, it should be broad spectrum. What do we mean by broad spectrum? Here we go back to the discussion of UVA and UVB. So broad spectrum means that it covers both the UVA and the UVB rays. And this is important not just in protecting us from skin cancer, but also because the UVA is implicated in skin aging. So always choose a sunscreen which specifies broad spectrum on it, UVA and UVB. Coming to SPF, what SPF means is basically how well the sunscreen protects you from a sunburn. So it tells you how much UVB light the sunscreen can filter out. The recommendation is to use a sunscreen that's SPF 30 or higher. Now, again, you will find maybe sunscreens that say SPF 70 or SPF 100, but to know, SPF 30 already filters 97% of the UV rays. And actually, there is no sunscreen that can filter 100%. So anytime you see a sunscreen that says SPF 100, this is just a marketing strategy. Generally, I like to recommend an SPF 50 rather than 30 because people tend to under apply the quantity of sunscreen they should. So by recommending an SPF 50, even if you under apply slightly the quantity, basically you're getting the SPF 30 coverage. Next, always choose a water-resistant sunscreen, which basically means that even if you get sweaty or you go in the water, it's effective for 40 minutes. Obviously, if you go in the pool and back out, you need to reapply the sunscreen. Any sunscreen that you use, it should be reapplied every 2 hours. Many people get surprised by this, but actually the sunscreen only lasts 2 hours on our skin because the sun's rays break down after this and you lose the effectiveness. So if you're out during the whole day in the sun, you should carry the sunscreen around and reapply it every 2 hours. When it comes to sunscreens, we actually have two different types in the market. There are the chemical sunscreens and the physical sunscreens. What is the difference between the two? Chemical sunscreens are the ones that basically contain ingredients such as the avobenzone, oxybenzone, etc. So here, the actual chemical absorbs the UV rays and filters them out. And then the coverage of this, whether it's a broad spectrum or not, depends on the chemical filters that are used. Whereas with the physical sunscreens, it doesn't actually absorb the UV ray, it just reflects it. Physical sunscreens by nature, they're always broad spectrum. So if you choose a physical sunscreen, you know that it is broad spectrum. Whereas if you're choosing a chemical sunscreen, you need to be sure that it specifies that it's broad spectrum. The other advantage of choosing physical rather than chemical sunscreens is that the physical sunscreen is immediately protective. Most of the sunscreens, if they're chemical sunscreens, they need to be applied about 15 minutes before you leave the house in order for them to become efficient. While with the physical sunscreen, the moment you put it on, it reflects the rays and it gives the result. Lastly, the physical sunscreens, they may be more well tolerated for the skin, especially in people who have sensitive skin or they have skin issues such as rosacea, which can make them more sensitive. We usually prefer giving a physical sunscreen rather than a chemical one. So what about babies? Is it safe to use sunscreen in babies? Should we apply sunscreen? Actually, the sunscreen has not been approved for babies below the age of 6 months. So younger babies, we should just really protect them with the clothing, with the hats, keep them indoors. Above the age of 6 months, we can start using sunscreen, but it's still preferred that we use a physical sunscreen because the skin of the baby is so sensitive and those are more well tolerated. Concerning how much to apply, most adults actually under apply the amount of sunscreen. So what we need is 1 ounce of sunscreen to cover the whole sun-exposed skin. So the size of a whole palm, actually. And as we said, it's to be applied 15 minutes before leaving the house. And men with hair thinning, you should even apply it on their head or wear a hat. Lastly, about sunscreen, I'd like to talk a bit about the texture. You'll notice that you have different textures within the same brand of sunscreen. So you can find cream, you can find gel, you can find fluid with exactly the same brand name. The difference of this is just the texture. So people with certain oily skin or acne-prone skin, they would benefit more from using a sunscreen that is in a fluid form or a gel form. So it's just less oily in order not to bring out their acne. Same with men who don't like, or of course women who don't like applying something that is greasy. Always go for the sunscreen texture that says gel or fluid because it's more watery rather than creamy. Harmful habits. So today we have this fashion of using these indoor tanning salons or even with natural UV rays to get a nice tan. I mean, the tanning might look nice, but really, is it worth it? Is it okay to do? Well, a suntan is actually evidence of DNA damage. The reason that we get a tan is basically because when the skin is exposed to the UV, it tries to prevent further energy by producing further injury by producing melanin, which is what gives the skin its darker color. And this is what gives the tan. So whenever we see a tan, it's just the DNA damage. So we know that we've actually harmed our skin. So to answer, there is no such thing as a safe or healthy tan. Anytime we are tanning, we're actually harming our skin. And the effects of the chronic sun damage, it's not just limited to skin cancer. It also leads to a lot of other problems, including skin aging, including sunspots. These small brown spots, they look like freckles. We see them on the body, on the face. It can lead to many pigmentation problems. So development of brown patches on the face, like the pregnancy mask. All of this is from chronic sun damage and tanning. Sunburn specifically plays a major role in developing melanoma. So we know that chronic sun exposure, of course, increases our risk of skin cancer, but what's even more risky than that is getting sunburns. And actually just one blistering sunburn in childhood more than doubles a person's chance of developing melanoma later in life. So when they compared someone who was chronically exposed to a mild amount of sun versus someone who got a few sunburns, it was actually much more harmful to get sunburnt, even if it was just a few episodes, rather than milder sun exposure over many years. So really the worst thing that you can do for your skin is getting intermittently sunburned. Few words on indoor tanning, these machines that some people use to go in and have a nice color. They may be marketed as being a safer alternative to natural sunlight, but actually, according to many studies, they raise this risk for skin cancer, and the risk is actually high to an extent where the FDA has forced these indoor tanning beds to have a black box warning where it says that it increases the risk of skin cancer. So in one study where they had 63 women diagnosed with melanoma before the age of 30, which is really a young age because, as I said, melanoma in younger age is quite rare, 61 out of these 63 women, so that's 97%, had used tanning beds. So this just goes to show that in this age population, especially in the younger adults, indoor tanning is a primary risk factor for getting melanoma. And actually, if we are to compare the indoor tanning beds with the natural UV, in some studies, they found that it gives 15 times more the strength of the regular UV. So just one indoor tanning session can increase the risk of developing skin cancer melanoma by 20%. Lastly, how about vitamin D? All this talk about sun protection, but we know that we want vitamin D, right? And they tell us that we need to be in the sun for vitamin D. So what's the balance here? Well, it's true we need our vitamin D, but we need the sun protection just as much as you need the vitamin D. And actually you can have both without the skin damage and without getting the nutritional deficiency of vitamin D. How is that? Well, it is true that when your skin is exposed to sunlight, it makes the active form of the vitamin D. But actually, you only need such a minor amount of sun exposure to produce the vitamin D that your body needs. And actually, when you're out in the sun for a longer time, this extra ultraviolet is just going to harm your skin. It will not produce you extra vitamin D. So any extra sun exposure will dispose of the vitamin D and you'll just be getting the harmful effects of the sun. And clinical studies have never found that someone who uses regular daily sunscreen, that it will lead to vitamin D insufficiency. Now, all the studies show that people who use their sunscreen regularly can still maintain their vitamin D levels. How is that? Basically, you can acquire vitamin D from a combination of diet and supplements. So make sure you focus on eating the foods that are rich in vitamin D, such as fatty fish like salmon, mackerel, tuna. Those are especially good sources, including other foods such as milk and orange juice. And just this slight mild sun exposure that you're getting by just going from your car to your work, even while you're wearing your sun protection, is enough to convert the vitamin D into the active form, what you need for your intake. And even if you're still vitamin D insufficient, it is still better to take supplements of vitamin D than go out in the sun to replenish your vitamin D and then get the problems of skin cancer. Thank you. So I guess we can open for questions now.
Dr. Rima, thank you so much for that very full session with lots of information. It's obviously a very popular topic. We've had nearly 100 people on the call today, so thanks so much for your time.
Thank you.
I'll just read out some questions if that's okay.
Sure.
Just that are in the text box. So one question is, hair fall is related to skin problems or vitamin D deficiency? That's a question. And do you have any comments on possible natural ways to improve? So hair fall related to skin problems or vitamin D deficiency? Thank you.
So when it comes to hair fall, we have many different causes. One big one is genetic factors. So I'm not sure if the question is concerning male or female hair loss, but genetics plays a key role. So just like many men, they start to lose hair with age. Women the same, they lose from their hair density. Other factors that can lead to hair loss is anemia. So if they have a low iron, and vitamin D as well. Usually to help this, we encourage the diet that I spoke of, and we give supplements. So it is still better to give supplements than, because even if you go out more in the sun, it's not going to replenish the vitamin D.
Okay, thank you so much. Next question is body acne back and front a type of skin cancer? I have a lotion in the first place for acne and it worked, but the acne was back again a month later. I got, I'm just going to try and pronounce this word, fibromycin for 1 month, but it seems that also that doesn't work and I still have itching and acne. Please suggest what I should do. I'm not exposed to the sun by large. Thank you.
Based on the description, I would assume that it's really just the regular acne. No, it's not related to skin cancer. Acne by nature tends to come back. So this is one of the issues that we need to constantly use treatment. The treatment that was mentioned is a very commonly used treatment for acne. It usually gives results, but what is important is to follow up and continue with maintenance. So many a times we give the acne treatment, it improves, and then we stop it, and then a few months later down the line it comes back because we didn't stay on a certain lotion or cream maintenance regimen. So this is the key. Once you start the treatment, make sure that you still follow up with your dermatologist to stay on maintenance, or else probably the acne will come back. If it didn't respond from the start, that means the treatment was very mild. Then we need to go for a stronger treatment given by the dermatologist, such as Roaccutane or others.
Okay, thank you. Another question is, what is the ideal exposure under the sun in order not to get skin cancer?
So the ideal exposure under the sun is to avoid midday sun. So between 10 a.m. and 2 p.m., we don't want to be except in the shade or indoors. There is no amount of sun like tanning that is healthy, but if you're out in the sun, if you wear your sunscreen, if you're wearing your protective clothing, then that's fine. There's no problem with that.
Okay, great. Thanks, Doctor.
Of course, with reapplication every 2 hours. I always stress on this as well.
For sure. So we have a question about vitamin D relating to prevention of COVID. Is there any relation to that?
Not really, no. Nothing that studies have shown.
You've already touched on the best time for vitamin D in the UAE. Do you want to discuss any more about that? What is the best time to get vitamin D here in this region? So I would
say in the early morning or in the very late afternoon, where the sun is not as strong and it just takes a few minutes.
There's a question about expiry on sun cream and also some recommendations for brands. I don't know if you want to share that.
But would not get into brands.
Sure.
Yeah.
But in terms of expiry, is there expiry on sun cream?
Yes, sure. So the expiry date would be on the back.
Okay, thanks. There's another question. Can acne marks, and I'll spell the word KELOID, keloid type, turn cancerous?
No, they cannot turn cancerous, but they should be treated with either a laser, or there are other modalities we use. But no, they don't turn into cancer. They're more of a cosmetic annoyance.
Okay, thank you. I have a question from somebody who's asked, my child has a patch of thick hair growth on her thigh since her birth. Can this lead to melanoma in the future? Thank you.
Based on the description, I assume what she means is that they have a congenital mole which has hair on it, because very frequently birth moles can have hair within it. Usually if it's a small size, so we're talking about less than 10 centimeters, it is extremely rare for it to turn into melanoma. But if she notices any changes in it, like if it's growing very quickly or if it changes color, then she should get it checked. But generally, if it is not from the giant ones, so not more than 10 to 20 centimeters, I wouldn't worry too much about it developing melanoma unless really there's some major changes in it.
Okay, thank you. There's another question. I have extreme itchiness behind ears and dryness. What would be the cause and how to avoid it? So itchiness, extreme itchiness behind the ears and dryness.
So this would probably be a part of eczema, but again, I cannot really give a prescription treatment just online without seeing the patient. So it would need to be examined, but basically it's something that we can address with a lotion and a shampoo. But I would rather not give, prescription treatments without examining the patients.
No problem at all. Doctor, one more question. Is the link between vitamin D deficiency, or is there a link between vitamin D deficiency and skin cancer? No, there is no. One more question. I have Vitiligo. I would like to know if I need any particular advice to improve the condition or my gait against skin cancer. I'll just spell that word, Vitiligo.
Yeah,
yes, thank you.
Yes. So for vitiligo, first it depends how old the lesions are, how old the problem is. If it's pretty recent, I would encourage the person asking the question to seek treatment, because we can really improve on the appearance of those with prescription creams. And I usually advise my patients that have vitiligo to get a mild sun exposure. So like we were saying, like in the early morning or in the late afternoon, because it can help recolor the white spots. but not during the midday, because the skin there is whiter. It is much more sensitive to the sun, and so it can easily get sunburned, but it is not particularly prone to skin cancer. It's more of a sunburning issue.
Okay, I have an interesting question. Is there any relation between foods and vitamin D, or can we get vitamin D from certain foods?
Yes, so usually fatty fish like tuna, like salmon, even milk, those are usually fortified with vitamin D. So we should focus more on the diet and less on the sun.
Okay, and then one more question before I let you go, Doctor. For off-the-shelf vitamin D tablets, is it possible just to take tablets from the pharmacy, or is it best to go to a doctor and have a certain level of vitamin D recommended?
Yes, it's always better, because we like to test the amount of vitamin D in the blood. Different people have different amounts. Some people are very deficient, some people have a good store. So it's always better to get a blood level of the vitamin D for the individual, and then based on that, the dosage of the recommended supplementation is different.
Thank you, Doctor. We don't seem to have any more questions, but it was very informative. So thank you so much for your time today.
Thank you. Thank you so much for having me, and thank you for everyone who joined us today. And thank you for your attention.
Thank you. Thank you. Take care. Have a good day.
You too. Bye-bye.